If you're dealing with an injury and you're wondering if you should get an MRI, you're going to want to watch this episode. Hey guys, I'm Dr. Josh Jagoda, sports rehab chiropractor, and today I'm going to answer all your questions about an MRI. Should you get it? When do you need it? What you should consider? And does it even help long-term or short-term for you to get this MRI? There's going to be a whole bunch of different things that you're going to need to know, so make sure you watch this episode all the way to the end. Hey, before you even get started with this content, make sure you download our free low back pain relief guide. It's a completely free guide and it's going to help you with your low back pain. Let's get into it. So one of the most common questions I get is, should you get an MRI before you start care or start treatment with a physical therapist? Now, some people come in completely with an MRI. Some people do not have an MRI, or they don't have an updated one roughly within 1 year or so. It's kind of updated. So I really don't think that most people need an MRI right off the bat, but there are some few things that we actually have to determine before we actually understand this person, right? First things obviously are clinical history, what's going on, but more importantly, and things that are going to be more relevant for you is, have they had care before? Have you had any care before? Have you had any treatment before? Have you been screened out by a doctor or any red flags? Because ultimately, this is actually going to answer a lot of your questions right here. Ultimately, the determination on do you need an MRI or not need an MRI depends on a lot of these factors. And one of the factors are ongoing symptoms, changes in symptoms, red flags, things that medical professionals will have to rule out, yellow flags, so to speak, and things that are actually getting better or worse. So for example, if you're having numbness and tingling into the leg and it's getting worse and it's getting worse and you're starting to get progressive muscle loss and there's starting to be bowel and bladder changes and there's starting to be neurologic onsets where it's getting worse significantly, we really do need to likely get an MRI. So this information needs to be conveyed from not only you to the practitioner, but it also needs to be done from the practitioner to the patient, because we can actually rule these things out. So to say this bluntly to you, say, do you need an MRI? I can't say yes or no. I need to ask you a bunch of different questions about your history, about your current injury, and about what's actually happening so you can determine if it's getting better or worse. Now, I understand most patients are going to come to me and say, hey, my symptoms are getting worse. Well, that's why I'm seeking care. Well, we need to decide, are you seeking care and getting worse because you're not treating the problem properly? Is it not being managed well? Are you doing the things that are irritating it? Or does this actually need an MRI, right? There are so many different factors. So again, getting screened properly is going to understand if and should we get this MRI. And what that tells me is that if I can stop the symptoms or start the symptoms, I can likely treat this type of condition. So the truth is, we don't necessarily know until we screen you, but we need to determine if we can actually get it better or not. And these are up to the clinical decision makings of not only the clinician, but you as well. And we have to feed you in on that loop. A big factor with regard to finding out if you actually need that MRI or not is going to be as you start therapy. So as you start care with somebody like myself or a practitioner nearby, what you're going to notice is as you get better, you're going to likely need the MRI less. If the symptoms get the same or get worse, then it's probably likely one of a few things. One, the practitioner is not treating the right condition. The patient, meaning you, is not doing the things that they need to do. Or maybe we're doing all the right things and the symptoms are, or the problem is actually stubborn and we do need some insight on it. These are real important things to notice, because if we are actually having worsening symptoms and they're not getting better, it might be a stubborn case and it might be something that we need to investigate further. So if you start care and it's been like 6 months and you still feel the same, if not worse, or if you started care 2 weeks ago and it's significantly getting worse, you need to talk to your practitioner, because you might need that MRI and you might also not. You need to just have that conversation with them. I also have a pro tip for you guys. I know if you're dealing with an MRI and you're trying to obtain one from a practitioner, you might have to see a physical therapist or chiropractor, then you might have to get referred to your general doctor, then to a specialist, and then they might send you back to PT, and they might send you down the road to another MRI facility, and it might end up taking 8 weeks to figure this out. Now, I understand that's frustrating, but there is a little bit of a loophole, and that is a cash pay option. And I know for some people it's not an option, and some people it is an option, but people like myself and people who have practitioners and have good networks, we have relationships with good MRI facilities. And I can often get a lot of my patients MRIs for under $300 or under $250 if it is done within a certain period of time. And usually I can get people in within 3 or 4 days. So I know that for some people that's an option. For some people that is not an option as well. If you need that MRI and you're really looking to get that quickly to find out really what's going on, there is a way to get it faster. Sometimes a copay is about $100. For the extra $150, it might actually be worth getting that MRI in 3 or 4 days versus waiting 8 to 10 weeks. So now that you understand, if you need an MRI, if you do get that MRI, is it going to even be valuable to the clinician? And this is really important because sometimes the research at this point in time, as far as I know, does mean that we cannot always correlate the injury, aka your MRI, and what's going on in the spine, with the actual problem. What does that mean? That means that if we see an L5 disc bulge and you're not even having low back pain, well, how valuable is that L5 disc bulge on an MRI? It's not very valuable at all, right? So it's really up to the clinician and to the person understanding, does the symptoms correlate with the MRI, and does the MRI correlate with the symptoms? To be honest, it just means potentially you may need the MRI to confirm what the practitioner already knows, because a good exam is going to likely give you 90% to 95% of the diagnosis, and the MRI is going to confirm it. Let me say that again, because this is what's going to likely happen. We as clinicians have an understanding of what might be happening with you, but we don't have a guarantee until the MRI confirms it. And the MRI doesn't always confirm, and you might actually see a lot more things going on. I can tell you from many patients over the years, I see L5, L3, this, that, the other things, stenosis, and people have zero symptoms of it. I've also seen a very perfect looking MRI, and I've seen the people with crippling low back pain. So it's really hard to always correlate the symptoms with how the structure and how the function works. So you need to potentially do both. And that is what's going to literally help you. Now, there are also factors that play into an MRI. Now, if you're getting a surgery, an MRI or an orthopedist is going to want to see that MRI. And if somebody is really trying to confirm or deny something or rule out something, you may really need that MRI. And yeah, an MRI can really change your treatment plan, but the rule of thumb that we have is that if an MRI, if it's positive and it does not change our treatment plan, then it's likely not the best fit. Let me say that again. If I think you have an L5 S1 disc herniation or a torn rotator cuff, and we treat it as that, and an MRI is going to confirm that, it was a waste of our time because we already knew and we already suspected that. So if we treat it as is, and then we go back and we see that MRI is positive, it was kind of a waste of resources on your part. Another major consideration that you should have when it comes to an MRI is, have you had therapy or treatment for this at all? If you haven't had any therapy whatsoever at all, even a little bit for an extended period of time, it's probably not worth it. Another major factor for getting an MRI or not getting an MRI is asking, have you had any treatment whatsoever? And when I say treatment, have you had a proven system, a plan, an extended period of time getting treatment to see how things are progressing? Most people say no, and that's the problem, is that treatment is actually very, very, very effective. More than 90% of cases do well with some sort of conservative care. And as a result of that, if we can ward off an MRI, not need it, and not need to spend extra time, energy, and money understanding what's going on, and we can just treat the problem, this will not only save you a lot of time and money, but it's going to get you on the fast track to results. Also, the chances of you needing physical therapy or treatment or chiropractic in addition is also really, really great. So even if you have this injury, you're gonna likely need some sort of therapy anyway. So you might as well just do some therapy, get some treatment, and then at the same time try to obtain that MRI. And if you end up getting out of pain and not needing the MRI, you can always cancel or reschedule that MRI for a later date down the road. So MRIs are great. They're a great piece of equipment. I use them all the time, but they do not substitute for treatment. So in conclusion, I know I talked about a lot of things regarding MRIs, but you really need to start some treatment while trying to obtain that MRI and hopefully not need that MRI overall. If you are having worsening symptoms, you need to speak with your clinician, your doctor, so that you can really get in and potentially get that MRI faster. And there are, of course, loopholes to get that MRI quicker if you have the right network or the right people having the correct network. So in conclusion, there are a lot of information on MRIs because they are a fantastic piece of information. They can really help diagnose and confirm things, but they do not replace treatment and treatment protocols. So a good clinician is going to be able to figure out what's going on, and an MRI will likely confirm it. But the truth is you're going to likely need some sort of treatment prior to, and an MRI can not only be very valuable, but it can also be a big waste of time, energy, and money for you. Finally, it also gives some information about your condition. It may show you more arthritic changes or things that are happening that are not necessarily valuable, and it may also show some things that are valuable. So it's really up to you and your provider to decide what is going to happen, who can actually order this, and is it even valuable for you? Because you have to correlate the clinical history, the current condition and their history, the current physical exam with the MRI. It is not just a yes or a no answer. And unfortunately, this is a little bit complex, but I see this all the time. And I'm not saying I'm trying to talk you out of an MRI, but I am trying to educate you and understand that, is this MRI actually valuable? Is it going to provide value for you? And is it going to help me help you more? So these are things that you need to think about. If you decide that you need an MRI, great. Hopefully it helps you. Thank you again for watching this episode all the way to the end. I'll see you guys soon. Bye.